Welcome families to our Family Friday webinar today. We're talking with our colleagues in Student Health Service who will talk with us about insurance requirements and immunization requirements, which are very important topics, especially in this last year. And they are experts in their area and will give you the information that you need to help your student prepare to come to Emory and be healthy and ready. So we're excited to have you here. Many of you are joining us for a second time because we welcomed you last week. But as we always do with our webinars, these are recorded and you can come back and look at them in another time. We send that out, we put it on the parent portal, and it's on the New Student Programs website. So we want you to know that this information, of course, is live today, but it's also going to be ready for you in another format. I'm, as I mentioned, Bridget Guernsey-Reardon. I'm with Emery Family Programs, and it's my pleasure to collaborate with my colleague Sherry Oberens and her staff in New Student Programs in the Office of Undergraduate Education to bring these to you every week. So Sherry, I'd like you to be able to introduce yourself and say hello too.
Hi, yeah, thanks Bridget. I'm Sherry Oberens. I work in the Office for Undergraduate Education, which is academic affairs here at Emory College, and we're just so happy to have you back joining us for the second of our 8-week webinar series. And before we turn it over to our great panelists from Student Health, we're going to start with a quick poll to get a little sense of where you're all joining us from and to see if you have been reading over your new student checklist that your students have actually received. So give you just a few seconds to answer where you're joining us from, and also the deadline for all of your health documents and immunization forms.
And there's not going to be a test on this afterwards, and every response is a good response. So we just want to have a chance to be a little interactive with you today and find out who we're talking to. So thank you for being with us. We know this your time is valuable, and we appreciate your support of your students. So thank you.
Absolutely. And we're having a little bit of fun with webinars and polls too. Like most of us around the country and world, we've all become experts at Zoom and trying to be as interactive as possible. A few ground rules for today. Our panelists are going to present lots of great information. If you, excuse me, Dust, if you do have questions, please feel free to use the question and answer function in the chat. If it's something that we know we're going to get to live, we'll let our panelists answer live. We also have some great people in the background who will be answering questions along the way. Excuse me.
Yeah, and so just so you know, any question you have is a good question because that means that we need to cover something that's important to you. So please, as Sherry said, put those questions in there. We'll try to get to as many as we can, and then we'll have other means for you to be able to communicate with us so that you get answers and responses. So you can see here's a little bit of our poll results. So we get an idea. This is similar to last week. So many of you are 500 to 1,000 miles away. And it's great to have you here. It's one beauty of Zoom is that we can travel to you wherever you are. So we're excited to have you here. So thank you.
And the second question was the deadline to submit all of your students' health forms, documents, and immunization records. And the correct answer is July 1st, and we're going to go into lots of details about this. If you would like to submit everything by June 15th, you get extra brownie points from us. So yay, yay, yay. For those of you who put July 15th and August 1st, we're just going to bump that up a little bit, but our colleagues will also talk to you about if you're having trouble getting any of those things in, what you can do as well. So I am going to...
Luckily, as you'll learn today, the health insurance requirements are later, not until September 15th, but they'll cover all of that. And I'll give it back to Sherry, who will give us our first panelist, expert in her field.
So like we mentioned, we're talking about health insurance and immunizations. And we're first going to be joined by Kim Taylor and Brenda Dickens. Kim is our Director of Student Insurance Services, and so has lots of great information. When Kim is finished talking about insurance, the other Kim, so the Kims are joining us today. Kim Crow, who is our Director of Nursing, will talk more about immunizations and vaccinations. And both are really knowledgeable just about how students can make appointments with Student Health and other things as well. I am going to plug already that over the next few weeks, we'll continue this conversation about healthcare, mental health care, and other care as well. So make sure that you tune into the next few weeks' webinars if this is on your mind, and we will remind you of that at the end. But without further ado, Kimberly Taylor. Welcome to this webinar, and we will turn it over to you.
Thank you so much, Sherry and Bridget. I appreciate that. Thank you, parents and students, for attending today's webinar. Like Bridget said, I know your time is valuable, so we appreciate you taking this time to share with us. I am Kimberly Taylor, Director of Student Insurance Services at Student Health, and with me today is also my colleague working behind the scenes, Brenda Dickens, Senior Insurance Specialist. And together, we are the insurance office at Student Health. And so if you need us, we are here for you and for your students. I first also want to acknowledge what a very difficult year we've had. I would be remiss in not acknowledging that. And so kudos to your students who have pushed through, made it through to this point, and parents who have had to be parents times 10, teacher and everything that comes along with that, if parenting is not hard enough. So they tell me. So just kudos to you for just persevering and pushing through and making it to this time. We are so looking forward to welcoming your student to campus. Again, being in a space that we have not shared with each other for quite some time. So it will be a warm welcome for sure. The goals today for our presentation are your students' access to student health services, the health insurance requirement, the waiver opt-out process, and our insurance options and coverage. So Student Health is located on Clifton Road, 1525 Clifton Road, just across from the Rollins School of Public Health. And we have access, if you can see the photo there, if your student can make it up those stairs, those flight of stairs, they're not doing too bad. But we do have access, direct office access in the back of the building, the rear of the building, and they can come right into our office. Our hours are Monday through Friday, 8 to 5 p.m. That is during fall and spring semesters. We also have an urgent care clinic on Saturdays from 10 to 1. So we are open 6 days a week to take care of all of your students' needs. During the summer months, like we're in right now, our hours shift a little bit. And so we are open from 8:30 to 5 o'clock. And we have suspended our Saturday clinic for now. So we will open again in the fall. We always have an after hours call center. So if we are unavailable during the after hours or on the weekends, your student can call our main line 404-727-7551 and be directly in touch with a facility and nurse after hours team member. So we are here 24/7 to take care of you and your students' needs. So important information about the student health services. And all students can come to student health services whether or not they are on the student plan. I get the question, all the time, I have other insurance, am I eligible to come to student health? And the answer to that question is yes, of course, and you are encouraged to do so. So if you do have other insurance, if your student has insurance that is outside of the student health insurance plan, then yes, by all means, they can come and see us at Student Health. That is a part of their tuition, and we encourage them to take advantage of those services that are already covered for them. And if I didn't mention, I'm the director of the Emory University Student Health Insurance Plan, also known as USHIP with a P. At Student Health, we offer services such as labs, vaccines, medications, procedures, x-rays. It runs the gamut. So anything that your student may need, we will certainly, we should be their first choice and their first point of contact. Again, our services, nutrition, primary care, labs, all of those services are covered at Student Health. Psychiatry are also visits that are covered by tuition. So psychiatry, again, I go back to the year that we have had, which has been very difficult for all of us, but particularly young people. And so, we have a great psychiatry staff at Student Health. They are located on the first floor of the 1525 Clifton Road building. Appointments can be scheduled by call-in 404-727-6145. And we also have telehealth appointments available as well. If COVID did one thing, it opened the door, and this is probably the only thing that it's done, is open the door to new technology and flexible, optional ways for caring for our students and for caring about patients. And so telehealth is here, it's not going away. It's another means of appointments for our students, flexibility, confidentiality. And so telehealth and in-person appointments are available at Student Health in our primary care and in our psychiatry department. Our accessibility is flawless. There is no referral needed for psychiatry. The charges are, the provider charges, no provider charges during the semesters. And there's no limit to the number of sessions. So if your student needs to see and seek medical attention, again, they are urged to do so. They can see the same provider for the 4 years that they are here at Emory. So at Student Health in our psychiatry department, there are no limits on the number of sessions. There is complete privacy and confidentiality with all of our medical providers, whether that is in primary care or the psychiatry department. And urgent mental health services, we partner with CAPS, which is the Counseling and Psychological Services, as well as the SIS team, Student Intervention Services. So both of those facilities, if there's an urgent matter, if they're a student in crisis, then definitely CAPS and SIS would step in and intervene. So,
Kimberly,
yes.
I just wanted to jump in here too to remind everyone that we will have representatives from Counseling and Psychological Services, CAPS, and the SIS team during our transition of care. And so kind of getting to learn all of Emory's acronyms. Bridget and I have been here for so many years, even we still have a hard time keeping up with them, but psychiatry is separate than the counseling services, and we will continue to talk about that in the next few weeks. So knowing just that they are integrated and that people are working together across campus is a great thing to keep in mind for now.
And I'm going to mention what SIS is. SIS is Student Intervention Services, and that's our social workers and our folks who work in campus life and work closely with health services and academics and all over the university. If a student might have an emergency medically that has already been taken care of, but maybe they're disabled for a short period of time, differently abled, or if they have a situation where they're dealing with a family crisis or something, they work with all these folks to make sure that your student has an integrated approach and a holistic approach to their care.
Thank you.
Mm-hmm.
So more great information coming in a separate session. So making an appointment at Student Health, your student can actually schedule their appointments through our patient portal, which is through Student Health. And that is, they should familiarize themselves. This is going to be their best friend. So going on to their patient portal through Student Health Services, they'll be able to schedule appointments, check their labs, check on their billing, check the status of any claims that are out there. So there are so many different levels of our patient portal, uploading their insurance information. Importantly, their immunization forms, which you will hear about in just a little bit as well. So patient portal is going to be your student's best friend.
Kimberly, you mentioned something really important. It's your student's best friend. And I think this is a really big topic for parents and families to talk about with their students, because I know many parents and families are probably right now the primary appointment maker and caretakers for their students. And part of this is that transition where your students are going to be the ones that have to log in with their credentials to get into that portal. So if these are conversations or even kind of testing it out and logging in now over the summer so that they understand where to find this or how to log in, we really encourage that. We will continue to remind your students of that throughout the fall semester, because sometimes student health is just an in the time of need kind of thing that you need, which is great, and they might not remember it, but this is a big shift for your students who are now becoming kind of the primary caretakers of their own student health.
Yep, perfect. Correct. And it is a very, very user-friendly tool. So if you go on to studenthealth.emory.edu, you will see the patient portal link, and just go into, your student will just go into that link using their user ID and password, and they will enter any type of appointments that they need, and uploading their immunization information. So that is going to be a great, great tool for them. Not to mention confidentiality. It is completely FERPA protected. And so your student can contact a provider of services confidentially and communicate with them in that way and in that manner. So it will be a very, very helpful and useful tool for your student. Medical insurance. So again, maybe not the most exciting topic, but so necessary, so absolutely necessary. All students since fall of 2006 are required to have health insurance in Atlanta and while they are a student. Very, very important. So it's a mandatory insurance waiver, and it's an opt-out process as opposed to an opt-in process. So if students do not waive out, if your student does not waive out, letting us know that they have other insurance, they will be defaulted onto the student health plan. And so that is what we want to avoid. If you take nothing else away today, please hear this message that the deadline to waive out is September 15th. And so if that does not happen, then yes, your student will be defaulted onto the USHIP plan. And it's very, very difficult to make adjustments, after that has happened. So we opened the waiver April 1st. Again, it does not close until September 15th, and a very, very crucial process to complete or to adhere to. The insurance requirements are on our Student Health Services website, again, studenthealth.emory.edu. And the list of requirements has expanded some. We had 3 requirements previously, and as the years have progressed, we found that, we need to expand, and, there's so many different requirements. Insurance is changing so often. It is an annual process as well. And so when you waive this year, you will be required to waive next year because your insurance can change. It's very fluid, it's very flexible. And so what insurance you may have today may change next year, it may change in the next 6 months. So it's very, very important that the waiver is completed each and every year. So our list of requirements are very specific. So one is that deductible, having no deductible greater than $2,500. What we have found is high deductible plans, if you have a $5,000, $10,000 deductible plan, students typically don't access the care that they need, knowing that the deductible is going to be their first out-of-pocket expense. So that really, really makes a difference. And so we set the level of $2,500 for the individual plan deductible. If your insurance happens to go beyond that or exceeds that deductible limit, then if you have a health savings account, or if you have, can certify that you have the financial means to supplement that, that difference, that variance, then that will be fine. And so is there, and I won't answer the question. Let's see, is there anyone on? Oh. Let's see, and the plan also excludes, our plan excludes pre-existing conditions. And so your plan, whatever insurance that you may have, needs to satisfy the requirements. There are still plans that have pre-existing conditions, believe it or not. And so, you know, that is crucial when students need care. You want to have a plan that has lifted the pre-existing conditions. That would be even under the ACA and the Affordable Care Act, where the pre-existing conditions have been waived. So if there are certain plans that have pre-existing conditions, they would not satisfy the requirement. The preventive care under our plan is also covered at 100%. That would be a requirement on an individual plan as well. In international insurances, if there is a US-based partner claim administrator, then that is okay. We will accept that as an alternative to enrolling in the student insurance, but it must have a US-based claim address. And lastly, 100% your student must be covered for the entire year that they are a student. So what we also found a concern with was, students, they waive out with one type of insurance, and by the time they come and see us at Student Health, their insurance has lapsed. And so that is what we need to avoid. So as you can see, that's why our insurance requirements have expanded from what we had in prior years. And, we want to keep our students safe. We want them to be able to access the care when they need it and have that care covered by their individual insurance. So again, we do not, have students, enroll in the student plan if they have coverage that satisfies the requirements. And all of these requirements are available to you and online at our Student Health Services website. So please take a look at these. And if you have other insurance and you have not waived out yet, please do so again by the September 15th deadline.
And families, this could be a really good opportunity for an educational moment with your student, even if they're just getting out of high school, but at one point they'll have an employer who will have an insurance plan that they'll need to look at. And this all seems so very complex. And as you know, even with your own insurance, sometimes it is. However, it's an opportunity for you to talk with your student about the insurance and what it means, and give them an opportunity to learn what is expected of Emory, and also help them, September 15th, if you have your own family insurance that meets all the requirements that Kimberly has just talked about, you definitely need to waive by September 15th. Or again, like they said, you will be charged. The other question, Kimberly, we're getting is, what insurance plans does Emory accept? That might be too exhaustive of a list. Is that on our website someplace, or someplace that families will know?
It is, and it's actually coming up in a couple of slides. Yep.
Great, thank you.
Yep. And so, and Bridget, you're absolutely right. Insurance, like I said, it changes so often, and it's hard to keep up. So I can imagine, first year student just coming out of high school, trying to do this on their own. That's why we're here. Yes, your parent is going to help you through that, but we are here as well. So if there's any questions, parents, if there are any questions, you're not quite sure if your insurance, satisfies the requirement, we are happy to, look that over and kind of help you with that. So I can imagine in the mind of a young adult entering this insurance world, yes, it can be quite confusing. And so, do reach out, do let us know if you have, any questions, with the process. So these are the additional steps to the actual waiver site, which is through Opus. So your student will go to Opus, which is opus.emory.edu. enter your student's network ID and password. It will prompt you to confirm and verify certain information. So you do want to complete the emergency alert and save that information. Just make sure all the demographics are correct and emergency contact, and save that information. And that will lead you to the health tile on Opus, which you would select. And you definitely want to make sure that your student uploads their insurance card through their patient portal. Okay, so as you can see here, the green border, that is the health tile. So once you've entered the information, you've certified demographics are correct, then you will be prompted to the health tile and you will complete the health insurance waiver. You will see the terms and the semester, the fiscal year. You will click on that link and enter your insurance information and submit your waiver to Aetna Student Health. It does go through a verification process because even if you're not sure, we don't know the details of your policy. And so when you submit your waiver, there is additional verification that is going to take place. And so that insurance information that you submitted, that will be streamed directly to Aetna Student Health, who will verify the information that you've entered, making sure that your policy satisfies the requirements and comparing those against the list of criteria that we just saw. And if your insurance meets those criteria and the requirements, then it will come back approved. If there is additional information that is needed or requested, then the Aetna Student Health will send an email. You will get an email notification. Your student will get an email notification that additional information is needed. And once you provide that, then the verification process will resume. So students, parents, please keep an eye out for email communications. That is crucial. You've already probably been bombarded with our waiver communications already. And if you submitted your waiver, then the communications you will no longer receive the communications. You will receive them as long as nothing has been done. So if you have not yet completed your waiver, then please keep an eye out for email communications to you and your student. We do send waiver emails to parents of first-year students as well, just so you can stay in the loop and kind of see this process through if you need to.
And Kim, actually, that is a good reminder for something that we talked about last week. So if you remember when we talked about Opus Access, everything that we're sending right now is primarily to your students. And over the summer, we'll send to both their Emery email and their personal email. If they have not updated their personal emails and it's now to a high school address that no longer exists, then they will still get things to their Emery email, but they need to be checking it. So everything's going to be going to your students. In order for parents to get updated information for things like this where they are sent, your student has to update your information as well. Everything that we have in Opus is originated from their high school to college application. And so if your email addresses or phone numbers have changed, you want to make sure that your student is the one that has to change that in Opus. We also talked last week about guest access to Opus so that you can log in and see some of this information yourself. Again, your student has to create those guest accounts. So please do not log in with your student's net ID and password, that is theirs. Encourage them to set up that guest access for you so you have your own login and ID. And when they set up that guest access, that they can actually click on the health insurance tile so that you have access to that as well. So I think I've covered all of that a lot. There were some questions again about how do I know if my insurance policy counts or if it's been accepted. Kim did a great job of explaining that. All of the criteria are on the Student Health website, and it sounds like that verification process will catch those who might not be up to date. But the follow-up emails will definitely go to your students. Can't guarantee that it'll go to you directly either. So this is great conversations that your students need to be checking their emails regularly for those updates.
And a couple more things. Kim, can you tell us if the Emory plan covers students when they're home over their fall break or over their winter break?
Mhm.
Okay,
Yep.
great. And can you tell us what the cost of the Emory plan is?
And that's all coming.
Okay,
Great,
good.
great
I
question.
looked at all, just like all of you, I looked at all the slides, but this is so content heavy that I'm asking questions too, because I looked at the slides, but this is why we record these, everybody. And you probably will have to go back to this one and, or tell other people that you might know, or look at it with your student, because this is so content heavy. And we want to make sure that you have a thorough explanation of what's going on. And one parent asked what onboarding is, and that's what this is. That's what we started last week. Onboarding takes place from the time your student deposits until they come in August. So we are onboarding you, and then after that, you're still a part of the Emory community, and you're still going to be finding out a lot of information that's going on.
And again, students have to set up the guest access in Opus. So unfortunately,
That's right.
parents, you cannot set up your own guest access. You cannot pick your login name. So you probably want to do that with your student. We have seen some very funny logins and passwords created by your students, so they have a sense of humor, but that is something that they have to initiate, and they do have control about what access you have. So great conversations to be had.
Mhm. Thank you both. And so the first question was the insurance that we accept at Student Health. And here's the answer to that question. We are providers of over 42 insurance companies, and happy to report that we just became contracted. We are now contracted with Blue Cross Blue Shield after many, 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 many years. Last May, we now have a contract with Blue Cross Blue Shield. It was always an accepted alternative to waiving out with the student insurance, but was not a contract at Student Health. And so students were not able to use their Blue Cross at Student Health. Now they can. I'm happy to say that. So if you have a United Healthcare, a Cigna, a Blue Cross, any other insurance, we will bill directly to your insurance if your student comes in to Student Health. Now I go back just a little bit because what I said earlier was that the visit to Student Health is no charge to your student, which is absolutely correct. However, there are certain services that will be charged. So labs, we do charge for labs. Certain types of exams, we do have to charge for certain type of exams, x-rays. So there will be some services that we do charge for. And in that instance, in those instances, that's when your insurance comes in and we will bill directly to your insurance. The only insurances we do not accept at Student Health are TRICARE, Medicaid, and Medicare. We actually do accept Kaiser. Medicaid, I will touch on a little bit because it's very important that out-of-state Medicaid, because we do have some students and families who are on out-of-state Medicaid plans. And so it's important to know that those plans typically, and what we've seen in our experience, is that coverage does not transfer out of the student's home state when they have out-of-state Medicaid. So if they have Medicaid in Texas, they're coming to Emory, those benefits will not transfer from home. And so at the very least, they will have emergency care, and that does not satisfy the requirement. So alternatively, if Georgia Medicaid is available, other alternatives are available, but just be aware that you're in out-of-state Medicaid would not transfer in the same way and would not cover your student here in Atlanta. And Georgia Medicaid is a very detailed process. And so it takes quite some time to complete and finalize. And so if you start that process, it would be best to do that sooner than later. But I did want to mention that.
And Kim, I want to clarify with a question we had. We had this on the earlier slide, and the earlier slide noted that everyone can come to student health if they have that approved insurance, and they're not billed for a regular appointment, correct?
Absolutely. Absolutely. Yes.
Okay, so they don't need to, we'll have on file that we have your insurance, but when you come for a regular appointment, like you have the sniffles, you're not sure what it is, that will be just already covered.
That's right. Yeah.
Okay, thank you.
Mm-hmm. Yep. So the visit to student health for any one of our providers is part of tuition. So there's no charge. Yeah. And so our student health insurance plan has 3 networks. And we have come such a long way in our plan. I didn't mention earlier, but I've been here over 20 years. So relocating, coming here to Atlanta, Emory has been it for me since I landed in Georgia. So very, very good partnership Emory and I have. And so I've always worked on the student health insurance plan and had a little mom and pop plan when I first came, didn't cover much, very difficult conversations to have with parents. There was a waiting period. We talked earlier about the pre-existing. There was a pre-existing exclusion on plans that we had prior. So we've come a long way, and we have a plan that we are proud of. It is robust in coverage. And the administrators are Aetna Student Health. We have been partners with them for 18 years now. And so, very, very strong partnership. So we have 3 networks of the coverage, 1 plan for all students and 3 networks. So when students are here on campus, they come to student health, no out of pocket at student health. Services are covered 100%. So those labs, those x-rays, those certain exams, annual exams that we charge for at student health, completely covered 100% by the student insurance. If there is something that we need to refer your student to, if there's to a specialist for further care, that is when there will be some out of pocket. And the Emery Core Network consists of all of Emory providers. So we have the Emory Hospital, which is right on campus down the street. We have the Emory Healthcare, Emory Specialist, and those services are covered at 90% with a $150 deductible. So the deductible would need to be satisfied first, $150 for the year. You can't beat that. I want to go back to school just so I can get that type of deductible. And services, would be covered with the 10% co-insurance. Now, the question was, does coverage extend when students are home? Absolutely. That would be the second tier within network. So when students go home, they're in New York or Texas, make sure that an Aetna provider is, that you access an Aetna provider, and that would be the in-network at 80/20 with a $400 deductible, and out-of-network, we have out-of-network for providers as well, 60/40 with the $600 deductible.
And Kimberly, can you clarify if that happens for international students when they go home to different countries, or if students are traveling abroad at all?
Right. So traveling abroad, and for international students at home abroad, that would be the out-of-network tier. So that would be the last tier, services covered at 60/40 with the $600 deductible. So that would fall under the out-of-network. And I know that we are against time here, and our coverage, I believe our question was, when does coverage begin, and the cost. So for domestic students, coverage will begin on August 15th. It's an annual policy, so what does run through the summer. And so coverage would terminate on August 14th of next year. And for international students, coverage begins on August 1st through next year, July 31st. And the cost is $4,018 for the year, and students are billed half of the annual premium per semester. So $2,009 in the fall, and then again in the spring.
Kim, you mentioned about kind of updating records, and there are a few questions in here about if a parent or family's insurance changes mid-year. So you know, they want to be on their home insurance now, but something happens to the family's insurance. Is this a kind of opt-in throughout the year, or are there ways to update insurance plans if things change?
Yes, absolutely. So thank you for that question. So yes, if the insurance changes mid-year and you still want to continue with an alternative plan, then contact our office to update that information. We will still verify your coverage, just make sure that your student has the coverage that they need. And we will update the waiver process as well, or go through the waiver site. So we will do that, because once the waiver closes on September 15th, students and parents will no longer have access. So it will become a manual process, which the insurance office, myself, and my colleague will take care of.
Great.
If students lose coverage mid-year and want to opt into the student insurance as a qualifying life event, they can do so at that time as well. And so a manual process, we will, our office will facilitate that enrollment, and mid-year enrollment is absolutely eligible.
And we know that we need to transition over to immunizations and vaccines too, but Kimberly, you've offered so much good information. There probably are questions that we won't get to even in the chat. Your email is phenomenal, and you have staff that can answer any of these follow-up questions too. So do you just want to share that real quickly, and we'll make sure that we mention it at the end too?
Absolutely. So if you have any questions, please feel free to email me at KTAYLO2@emory.edu. That is my personal email. And then we also have the mandatory insurance listserv at cc.emory.edu.
There was one question that we were asked to ask live about Kaiser real quickly. Kaiser's not on our approved list. Is that correct?
We accept Kaiser at Student Health.
Oh, you do?
Okay, yeah, so because it was listed as one that wasn't approved.
Exactly.
So we apologize for that
Yes,
error.
I saw that.
Got it.
Yep,
Thank you.
I wanted to clarify that. Yep.
That's a relief for a lot of Kaiser holders.
A relief, yes.
Yeah.
Well, Kimberly, thank you so much. We are going to transition over now to Kimberly Crow, who's going to talk about our immunizations and vaccination requirements. I know lots of good questions have already come in the chat for that. So Kim, take it away.
All right. Thank you, Kim Taylor. You did a great job. Well, got big shoes to fill here, but a lot of information. But want to welcome again all the families, the students that are participating. We just want to know that Student Health is here for you. I want to give you a little bit of overview of some of the services that we offer. We are conveniently located to campus. Like Kim said, you can come in the front. We have a parking deck in the back, so there's easy ways to get here. And we can move to the next slide. So I just want to talk to you a little bit about some of our services so that we're really well-rounded. We offer nutrition. You can have a confidential individual session with a registered dietitian that'll answer all your nutrition questions. They'll help manage any disease-related issues. They specialize in sports nutrition, healthy weight management, managing body image concerns, or even just to talk about mindful eating practices. So feel free to make an appointment with one of the nutritionists. We also offer LGBTQ care. We believe that every student in Emory has the right and should be treated with respect. So this is a safe place for a student that wants to come talk with one of our providers that specialize in LGBTQ care. And then we'll move on in. We have allergy and immunization and travel. So travel has pretty much been suspended, but we are getting it back up and running. So any of the programs that require travel abroad, or you can come here and get a travel consult with one of our nurses and get all your travel vaccines that you need. Also, if your student takes allergy serums, so we will administer those for you. We just require that you have an appointment with your own allergist, get your serums, at least have your first shot with your allergist, and then we will take over as long as the schedule is provided. So that's a good service that we offer. And like Kim said, we offer telehealth. This is for students that are in Georgia. You cannot be out of the state. But telehealth is an option to talk about some concerns that you don't need really a face-to-face of where they need to touch you. So a lot of this stuff can be handled, just by talking. And then if it requires an in-person visit, we'll progress to an in-person visit. But this is a great way to get some of your questions answered that don't require hands-on. Also, you have access to all your medical records. That's a service we will give you that, and you have access to your student portal. Can actually now there's a new process called Open Notes. You'll actually be able to see your provider visits on your student portal with all the information. Primary care. Let me talk a little bit about primary care. Primary care is, entails a lot. So we do physical exams. We offer urgent care. We have sports medicine. We have the lab. You can get x-rays here at Student Health, get your prescriptions filled, and also you can get referrals for specialists when needed. Women's health, we do yearly female exams. You can get pap smears. We handle abnormal paps. We do colposcopies. We do birth control. We do eating disorder consultations, contraceptive programs. So a lot of care for women's health. And then also Kim mentioned psychiatry. I won't repeat that. So one thing that's important for your student when they're coming to a city they've never been to and they're away from home is for them to learn what is the right level of care that I need. So most often you want to go to your doctor's office, which would be us, whenever possible to address your concerns. Like I said, we have telehealth. If you want to make a telehealth appointment, talk to a provider, you can also call our nurse line and speak to a nurse about some concerns that you might have. And then the next level is urgent care. Now we offer urgent care. We are not an emergency facility. So anytime you would need emergency treatment right away for life-threatening, Emory University Hospital is just adjacent to Student Health and very convenient to campus. And they have a 24-hour full-fledged emergency room. So those are just some of the levels of care. I think it's just important to, because it's hard sometimes to make that decision, but we're here to help that student make the decision and see what the level of care that they need. All right, so now let's go into the big one here, the immunization requirements. So students are required by the university to be compliant with the Emory University requirements as guided, and we go by the CDC and the American College Health Association. These requirements will be part of the onboarding requirements to safely arrive on campus. And all these requirements really are to help keep our environment safe and that we can all gather together and not worry about some type of other pandemic coming out. So there is a really good video on this website. It's on the front page. I put a little snippet of it on here. This is a 2-minute video that goes through the forms. It's very informative, and I would suggest that everyone watch that, the student and the parents. So what's important here, we have 2 sets of forms. One is for the non-health science, and that is going to be the new students coming in to pick that form. Don't pick the form for the health science program. If later they get into one of the health science programs, that form will then be required. But just make sure you pick the right form, I think would be the best information I can give you on that one. And then it's really 4 easy steps. You print off that immunization record, you get it signed and verified, complete the tuberculosis questionnaire, get that uploaded. You enter all your immunization dates on the portal, and then upload your signed and verified records, and then someone from our immunization team will go on and verify that record and confirm it. But we are asking the student to help out, put the dates in. It's going to be really important. So let's go over the required immunizations.
Sorry, Kimberly, one more thing. A question about who does this need to be signed by? That's a question that's come up a few times.
The form is signed by their provider.
Signed by their provider. Okay, great. Thank you.
And we call providers either your healthcare professional, your doctor, your nurse practitioner, your PA. So let's talk a little bit about the required vaccines. The COVID-19 for one is mandatory for students this semester. Right now I know there's a lot of vaccines out there. So right now, what we are accepting is called Sinovac, Sinopharm, Pfizer, J&J, the Moderna, or the Oxford AstraZeneca. Now that's 6 COVID vaccines that we're accepting. Please know that tomorrow a new one could be approved. So we'll keep our list updated, and as we accept more, we will that'll put you in compliance. Next is your MMR. Now the MMR is 2 doses. The first dose should be after the first birthday, and the second dose from ages 4 to 6. You can also, if you don't have proof of your MMR, you can do a lab test showing immunity to all 3. So that the lab test that can be, you have to attach that with the form, your lab results. Varicella. In the past, we have accepted the history of disease. We are no longer accepting history of disease. You must have 2 doses of varicella. The first dose is after the first birthday. You can get a titer if you cannot prove that you have had your 2 doses. Go ahead and get your provider to draw a varicella IgG titer, and then you would attach that result. If your titer does not show positive, then you have to get a booster. Okay. Hepatitis B. That is a 3-shot or a 2-shot series. If it's the 3-shot, they have to have normal spacing 0, 1, and 6 months. The 2-dose series, if the student is not immune to hepatitis B, they can do another 2-shot series, and that start after the age of 18. And then we'll also need a quantitative lab result attached with that. If you can't show proof of either the 3-shot or the 2-shot, then have your labs drawn and attach that results. Seasonal flu, that will be required again. This was last year was the first year it was actually in January was required. So we will continue with that, and we will start to give the flu shots in September sometime. The earliest you can receive a flu shot, we did see last year as early as July 1st. Some of the pharmacies have it, but really it's recommended to start in September, even October, just because the immunity is about 6 months to give you coverage. And so flu season runs all the way till March of next year. So like really from September to March. But last year we did remote flu clinics. We did them here at the Student Health. We actually went around campus and set up and gave flu shots. So the student, you'll have plenty of opportunity to get your flu shot here or somewhere around campus. A tetanus shot. You can have the TD or the Tdap, and that you just have to show proof of one of those in the last 10 years. And then the meningococcal ACWY, that is going to be required for any student living on campus, which is considered on-campus housing. All right, and these are some other vaccines that I'm sure some of your students have had, your children have had. Meningococcal B, that's important, but it's not required. It is recommended. Polio, a lot of, we get that when you're doing your babies. Hep A and HPV, that is one that is, if you're familiar, that's the human papillomavirus. That is recommended. That helps prevent a lot of cancers down the road. We have all these vaccines here at Student Health. Just know you can make an appointment with one of our immunization nurses and we can take care of you. All right, so let's talk a little bit about COVID. So here at Student Health, we do testing. We follow students in isolation and quarantine. We do contact tracing. So we have a whole team that is taking care of our COVID related symptoms and our students who are actually maybe have gotten COVID. We have the students can go on the student portal if they have a question. We have a COVID-19 provider. We also have a nurse you can ask questions. We have a separate respiratory clinic here that we do testing. Our testing has come a long way. I know that beginning July 1st, students that are not vaccinated will still have to do a weekly screening test. Now that's saliva based, and that will not be done at Student Health. That is somewhere else on campus that they would do those weekly testings. But if you're vaccinated, you do not have to do the saliva test. And also here at Student Health, if you become sick, let's say you get a call for a sore throat, we have a whole system in place to get you assessed. And if we need to do a PCR COVID test, we now have that in place here at Student Health. It's called Acula, and it's a nasal swab. It's not the nasal swab that goes way far back, if some people have had that. This is an anterior, just right about 1 inch inside the nose. Swab your nose twice, and then we do our little test. Takes 30 minutes to get a result to whether you're negative. This test is very accurate. So we have all sorts of ways to care for your students here on campus. We are here for you, and want you to know that, in the midst of a pandemic, that we really have a good plan in place and want to keep your child safe.
And Kimberly, there were a lot of questions that we just really want to redirect parents and families and students back to the Student Health website. So many of the COVID questions and the vaccine questions that you posed are definitely on the website. For international parents, the ISSS website has a recorded webinar and updated FAQs. The ISSS website has even given the updated on date, so you know when new information has posted. I think the takeaway really is for those students who are not COVID vaccinated yet, they will have an opportunity to get vaccinated on campus when they're here. And it will not slow down the move-in process. As Kimberly mentioned, testing will be required, saliva testing for all those students who are not yet vaccinated or who aren't vaccinated. And so that is our way of keeping the community safe. But there will be access. I don't have the specifics if you start your series, but you're in process, you don't turn 18 until August. If it's a delay and you're just waiting to campus to do it, that they will be available. But all those questions can be answered on the Student Health website as well, in much better detail than I think I'm able to do. So
and also on that website too will be where you could write in for questions. And so our recommendation is you ask sooner better than later. So if you have a question, go ahead and ask that and people will get back to you.
Yep. So just to recap, just a little bit of a checklist on where you can go to get started. July 1st is a big deadline. Complete your FERPA forms, consent for treatment. I went ahead and added, if you think your student may at some point during the semester want to do a telehealth, go ahead and do the telehealth consent. It's on there. That has as a requirement before you can talk to a provider via telehealth. Complete your health history. Get your insurance waiver in if you need to. But a lot of things to get going. I think that's all that I have.
Yeah. And this is, again, we're going to be talking about this a lot on June 25th, transition of care, but a lot of the great information that Kim and Kim both brought up really suggests that having those conversations with your students now, talking about the insurance, making sure they have copies of their own cards, how to make appointments, how to let people know when they're sick, getting those prescriptions ready and filled close to campus, especially if they're going to need refills while they're here, is great. Emery is lucky to have 2 CVS pharmacies on either end of campus. So CVS is great. And we know that Emory's student health insurance goes through CVS. But obviously some of your other providers might go through grocery stores or others. So we do have Kroger's and Publix's and Target's and all those things too. But finding a close provider and one that your student can get to easily is probably the most important. And CVS's are both walkable. So that's why we are pushing the CVS, even though there are others, I'm sure, within a 1-mile radius too.
Yep.
And also families, as we've always said, we gave out information today about who to contact with issues. You always know you could go to family@emory.edu email if you have a question. I always work closely with student health service folks and with Sherry's office, so we'll get you answers to what you need. Look at our websites. The new student programs website is awesome. It's a very good website with everything you need. We try to put the same type of information on our family.emory.edu website also.
So coming up, this was a really heavy, very heavy one. You can go back and rewatch this webinar at any time or visit Student Health's website. Next week, we're talking with Allison Butler from the Department of Accessibility Services, talking about ADA accommodations. And so those could be long-term chronic health issues, mental health issues, physical disability or other things, but anything that would be covered by the ADA and setting up those accommodations. Definitely, if you have students who have had any learning challenges, you'll want to tune into that too to make sure that you understand how to register and what accommodations would look like. After that, and we've alluded to this one a lot, the transition of care on June 25th will pick up from what we've talked about today and next week with accommodations. And so our directors of student health, of counseling and psychological services, and of psychiatry will all join us to continue that conversation of the transition of care. So again, if you don't have all of your questions answered for today or kind of what you need to do before your students come to campus, that will be a great one to tune into as well. We'll take a break for the 4th of July weekend and then pick back up in July, really transitioning more about involvement and res life, finding community, and housing and dining. So we're super excited to continue to meet with you all and to help share all the great resources. So Kimberly, if you want to turn your cameras back on, thank you again so much for joining us today. We wish everybody a very happy Friday, great weekend. It is summer for sure in Georgia, so really getting excited to welcome you all to campus in a few weeks.
Absolutely. Thank you so much.
Thank you, everybody.
Thank you for attending. All righty.
Help.
All righty. Bye-bye.